Let's get started. Thank you for coming. My name is Kandan Kulandaivel. I'm going to talk about ischemic stroke in young adults. Um, First, we'll define few of the parameters. We're not. What is a stroke? A stroke occurs when a blood flow to the brain is interrupted by a blocked or a ruptured blood vessel. We call it a brain attack. It could be either a ischemic stroke, which is caused by a blockage in the blood vessels of the brain, or it could be a hemorrhagic stroke caused by a rupture or a leaking blood vessel in the brain. We're going to look into today of the clotting type of strokes or the ischemic strokes. Next, we have to define what is young. Everybody is young in mind, so we all know that. But for the talk and for research purposes, young adult is defined as anybody less than 50 years old. It's been found that the incident rate of the stroke grows with age, being highest at 45 to 49, and it's lowest in the group of patients younger than 35. So, why is prevalence of stroke in young adults important? Because about 10 to 15% of the total number of strokes that are occurring in young people, the total number of strokes are happening actually in young people. This means roughly about 2 million adolescents and young adults across the world suffer from an ischemic stroke. What's impact of stroke? Just in the United States alone, someone suffers a stroke every 40 seconds. About nearly 800,000 Americans suffer a stroke each year. 4 minutes, every 4 minutes, someone dies of a stroke. And stroke, as we all know, is a leading cause of serious and long term disability. About 6.4 million Americans are stroke survivors. And as health costs, 73.7 billion was spent in 2010 for stroke related medical costs and lost productivity long term. We'll spend a few minutes understanding what is the pathophysiology of ischemic stroke. As we discussed, stroke happens because there is a clot in the blood vessel that supplies the brain, and the clot can start happening in the blood vessel. We call it intracranial atherosclerosis, or can travel either from the carotids or the blood vessels that goes to the brain, or from the heart. Here, a clot can form in the heart and go up, or a carotid plaque can break off. Other possibilities are when the stenosis, when the narrowing keeps happening, it can stagnate the blood vessels distal to the brain and can cause strokes. So this is in a nutshell pathophysiology of ischemic strokes. When you look at risk factors for stroke, ischemic stroke in young adults, guess what? It's the same conventional risk factors that are commonly seen in all adults that are noted. High blood pressure, diabetes, and dyslipidemia, high cholesterol, and high LDL are still considered important risk factors for all adults. And the prevalence among the young has been increasing over the last 10 years. Other risk factors that are unique to this population include smoking, physical inactivity, drug use. Drug use is an important risk factor. About 5% of the population between age from 15 to 64 use illicit or recreational drugs at least once a year. Pregnancy and puerperium risk is highest from the third trimester until 6 weeks postpartum. Contraceptive use raises the risk of ischemic stroke, even more so if associated with smoking or migraine with aura. The risk is tightly linked to estrogen content of the pill. Progesterone contraceptives do not pose a threat. Migraine with aura. This is a controversial area because there is a link related to the ischemic stroke, especially if it is tied to risk factors like we just discussed about smoking and oral contraceptive use. Malignancy with chemotherapy and radiotherapy can also increase the risk of ischemic stroke. In this talk, we're going to look into the multiple etiology, multiple causes of the stroke in young adults. As you see, about 30% are from cardiac cause, heart related conditions. 25% are related to blood vessel pathology in the form of dissection. And there is other conditions, inflammatory diseases, infectious diseases, blood disorders, genetic causes, disorders of the venous system, and cryptogenic stroke. We will spend a little time on explaining these causes. Cardiac cause, again, this is the leading cause of stroke in young adults, and a variety of conditions can be associated with strokes in young adults. But one condition I will discuss in detail is called patent foramen ovale, or PFO. So PFO is nothing but a persistent defect that usually the young babies have, which usually closes, but sometimes it can persist between the two atrial chambers in the heart. And no, 1 in 4 normal adults, normal people can have a PFO. But then when they looked at people who had had a stroke in young adults, about 40% of them had it. So from the initial thought was, oh, okay, maybe we can close the PFO and that will help prevent strokes. So this has been a hot topic in the stroke world for since I've been training, which was a long time ago. To close or not to close is the question. And as the recommendations have shifted in the past decade like a pendulum. Initial studies in 1990s revealed that there was indeed a benefit for closing PFO. And in 2012 to 2013, there were 3 studies, Closure 1, PC Trail, and Respect, which swung the pendulum to the other side and felt that there was no specific benefits of closing the PFO. Now, recently in 2017, Reduce, Close, and Respect, which was an extended study, are mentioning that there would be benefits to closing. So, yeah, what we think could be the reason for these discrepancies could be the patient selection in these studies. Large PFOs um, with associated features like atrial septal aneurysms could be something that we could be considering closing. So as I showed you, the PFO is a hole that you can see, and these are nowadays sophisticated devices which can be placed through a cardiac catheterization, and that can be helpful in preventing strokes. Moving on to the other causes of stroke, dissection, cervical artery dissection. Dissection is basically a tear between the layers of blood vessels, and it is about 20% um, the etiology of ischemic stroke in young patients. As you know, there are carotids and vertebral, and carotids are more involved than vertebral arteries. It affects men in larger proportion than women, and predisposing factors are high blood pressure, recent infection, and migraine. And dissection can be spontaneous or traumatic. So here in this picture, you can see this is the blood vessel, and due to either traumatic or non-traumatic reasons, there is a tear in the layer of the blood vessel, and the blood actually is accumulating between the layers of the blood vessel, causing it to get narrowed and thereby causing strokes. Um, these could be again from non-traumatic or traumatic. Some major traumatic events that could cause this include spine fracture. It used to be called as beauty parlor stroke when people would extend their neck in beauty parlor, and that could cause it. Any sudden severe rotations to the neck, roller coaster rides. I've seen patients sometimes have that. Also, forceful chiropractic manipulation of the neck can also cause these problem. So I tend to tell my patients to avoid any forceful manipulation of the neck. Um, Moving on, some inflammatory diseases, vasculitis, which is basically inflammation of the blood vessel, can cause the same problem, stroke in the young adults. And both arteries and veins can be affected. And the vasculitis could be either primary, which is from affecting only the brain, or secondary, like other causes, like lupus and other causes that can cause also affect the brain. Again, these are some of the primary causes of cellular nervous system. And of course, we all live in COVID-19 world. So infectious diseases are also linked to various mechanisms for stroke. Some viral infections like HIV, hepatitis B and C. We do see COVID-19 induced strokes in the last year. Bacterial infections, parasitic infections, and fungal infections can also cause strokes. Moving on to other causes, hematological disorders, blood disorders, people who have hypercoagulable states, who clot more easily than others, can be predisposed in this age group whereby they can have strokes. Among that, common conditions that we encounter are antiphospholipid antibody syndrome, sickle cell anemia, heparin-induced thrombocytopenia. Antiphospholipid syndrome is very interesting because it can cause clots in both arteries and veins, as well as pregnancy related complications. So we see them in a lot of young women. What it is an autoimmune disorder that where antibodies are produced against antiphospholipid, a cell membrane substance, and that is the pathophysiology of causing the strokes. Other hematological disorders, factor 5 Leiden, prothrombin gene mutation, antithrombin 3 deficiency, protein C deficiency, protein S deficiency, are some of the clotting disorders that we usually check for our patients to make sure they don't have this condition. Genetic causes. Many genetic abnormalities have been linked to the possibility of ischemic stroke in young adults. Family history of a young adult with stroke could be suggestive of a genetic cause. There's a couple of syndromes. One is called CADASIL, which is basically a mutation in one of the genes in chromosome 19, which results in a lot of many infarcts, especially in the subcortical region. Um, MELAS is another condition whereby strokes are caused by mutations in the mitochondrial DNA. This is another specific condition where ischemic stroke in young adults happen because of a problem in the venous system. Veins, as you know, drain the arteries. After the arteries supply the cells, the veins drain the blood. The obstruction of any of these blood vessels, venous system blood vessels, can cause increased pressure and thereby affect an area of the brain and cause consequences. And venous stroke are also associated with a lot of edema, and the venous strokes are also influenced by hormones. So the incidence is actually higher in pregnancy or postpartum. And with having high vigilance of about this condition can help diagnose this quickly and thereby treat them and prevent any catastrophic events. Even though I'm discussing all these causes, believe it or not, about 35% of ischemic stroke in young people have no identifiable cause, and we put them in the class of cryptogenic stroke. We can take a few minutes here about talking about stroke mimic. Stroke in young adults may other conditions may also mimic, especially in this population. Complicated migraine, where people can have headaches that can affect one side of their body, can also raise the suspicion of stroke. Seizures, after seizures, people can be weak on one side of the body, and sometimes when they present to the hospital, it can be confused with a stroke. um, Dizziness, uh, walking difficulties, balance problems can be seen in vestibular syndrome, multiple sclerosis. Again, those could be confused for a stroke. Myasthenia gravis, where people are weak, their eyelids are drooping, could also be sometimes confused for stroke. Other metabolic causes, alcohol intoxication, electrolyte disturbances can also be mimicked. So when we see patients in the emergency room, one must have uh, one must also worry about these other conditions at the same time. Think of the strokes. Rehabilitation for stroke in young adults is very, very important as soon as the stroke is over, because we have to start it as soon as possible. Different types of rehabilitation programs, hospital programs, extended care facilities, outpatient programs, and home-based programs. We do see a lot of impact of stroke of in family relationships with these young adults. Many studies have looked into it. About 13 studies report that about 5 to 54% of the participants experience family problems. 9 studies reported marital problems after stroke, including separation or divorce. 6 of those reported marital problems were direct consequence of the stroke. One study, about 5% experienced deterioration in the spousal relationship and experienced more conflict since the stroke. It also looked in other social activities. 10 studies investigated the impact of stroke on sexual relationship, and there was significant deterioration, about 5 to 76%. 9 studies reported that stroke on social and leisure activities revealed that decrease of 15 to 70% of involvement in social life and leisure activities. So you can see the impact that it can cause. So, so what do we do? Primary and secondary stroke prevention. Primary stroke prevention is controlling blood pressure, controlling blood sugars, and cholesterol. Recreational drugs should be actively avoided. Healthy lifestyle. And again, one other thing is stroke in elderly has much more awareness. Stroke in young people, we have to have a similar awareness programs in schools, and awareness campaigns could be helpful. Um, in summary, thanks for your time. Stroke in young adults is surprisingly common. The potential etiologies are very broad, and I touched on a few of these areas. Um, and thank you for listening.